It is true. Okay, it's 5:31. Call the meeting to order, the Vermillion County Board of Health. And we do have a quorum. Do we have a motion to approve the minutes for November 18th?
So moved.
Second.
All in favor?
Aye.
Any opposed? Okay.
Who seconded that? I did.
Election of officers for 2026.
I would like to nominate Kay as president once again. I'll second that.
Anybody else want to try? All in favor, I guess?
Aye.
Judy said she'd stay as vice president if everybody's nominating her.
I nominate Judy as vice.
I second. All in favor?
Aye.
How about the annual report? Wendy?
You all have that in your packets. Of course, you have we have to list the board in there and so the health department 2025 overview. It's just what we've done throughout the year. It wasn't, you don't need me to read that to you, do you? And we've done a lot, so very proud of the team. They worked hard. And then we did some pictures. And the pictures that you see, we actually had Dr. Weaver here and we did a presentation for her.
I want to come when she's here.
Yes.
I had to work.
She'll be back again this next year.
Yeah.
So, yeah. So the CPR class is still a go right now. I know Elanco's going to ask us back, Perrysville. So we're going to do several other things we've already done. The baby shower was a huge success.
I heard that.
Huge
I've
success.
heard a lot about that.
And we do still have diapers and car seats and playpens. So through our food distribution, we've been able to give them out as well. But we do still have some. And they have to fill out a card so we email that in. So, we know when they got it. So when it expires, they'll be notified. But
Good reports from the community.
yes.
I heard good things.
Yeah.
Mhm.
The food distribution is doing wonderful. What was our numbers last month?
350 some that we had come in, individuals that we served, 113 families, and keeping in mind that we had bad weather. So it was still very cold, a lot of ice. So I thought that was really good.
And you're happy with the food they bring and everything?
Yeah. Yeah.
So we did have a safe sitter class this last year, which was a success. So we're going to look at doing that as well. I didn't have the staff do a reading on what they've done since it is all in here for last year. But there's your vital records is all on there. Joyce keeps up with that and keeps all our numbers afloat and balances with me every month. So
How are we doing on the classes? Are we able to offer them for free or are they people having to pay?
So-
I know with our funding.
right now, we're gonna do, the last I heard, we're gonna do CPR every other month. Because we put so much money into that because of our trauma that we need. He was gonna do Heart Smart, but there was nobody that signed up, so that was supposed to start this month. I haven't heard about Dying with Diabetes yet. That's one.
Another one.
You don't think she's doing that? So, and we partner with Extension on those classes, so she does them as well. So as much as we can offer, we want to try to do it as much as we can without.
I'd also say that, attendance on a lot of the programs is gonna be down right now. I'm seeing attendance down on everything because of the weather. I mean, just our office, we've taken a 30% hit. That would never before, and that's the only thing that's changed.
Mhm.
So I don't think what we're seeing right now is really gonna be representative.
Right. So, and trying to get, the food distribution, like I said, is one of our biggest our outreach right now. So, plus our vaccines is slow right now. But these are all the numbers from last year. And then Lori's out of town, so she's not here for preparedness, but we just signed up to do the preparedness grant again. They did cut us $5,000 last year, and the county did pick up the salary. Yes, they have been very good with us with adjusting salaries like that. So, yeah. So right now we have 4 full-time employees, which it used to be just 1. Yeah. Any questions on any of the staff?
It's like they've been busy.
They have been busy.
They've been very busy.
Mhm.
I hope that you have it all documented like this too.
Yeah, we have to do a year-end report and have to have certain things. And this also goes to the state health department as well. So they expect us to be pretty transparent with everything. So Lynn and I, we did our best to do that. The budget, are you guys at the budget? Are you still looking at it? So the first budget, the 1159, the health department budget, that is tax dollars. So that is something the county council sets for us. Like I said, they did give all full-time employees this year $2,000. And the part-time employees, I believe,
Yes.
Hmm?
They got 1,000 for part-time.
yes.
Okay.
Of course, it all balances, all the, as you can see, the birth and death, that's what's collected. That Joyce collects the food permits, the septic permits. So you can see that our budget doesn't, what we collect does not cover our budget by any means. And this is all balanced back with the auditor's office. So we balance everything back to the county, and we are on the same page with our budgets.
So if we're having an excessive balance at the end of the year, does that mean the following years may not get the same amount?
No, they've been very good with us, that like a cash balance. So we have a cash balance at the end of each year on the health department, and we get to keep that. So we've had to go back in and ask for additional money from that, and they've never denied us from that.
I'm wondering why such a large amount on the training and conferences.
Well, that is because we had COVID money, COVID vaccine money. Didn't say that word, but we did. And so they have asked us, the state has required us to keep it into the 1159, the health department budget. So we put it there just so we can run it again. This year, it was not, we did not put that much in the training and conference. We have like 181,000 that's still there.
Yeah, you use for non-COVID related.
It can be used for whatever the health
So
department
everybody
needs.
needs to get some training.
Right, right. And we all do training throughout the year. But a lot of the training has been free. So we haven't had to pay. I know Vital Records we had to pay for, and yours is pretty much free. And then Deb's has been free. So a lot of it they're offering free to us. So we take it. And we do a lot of webinar trainings as well. That doesn't cost a thing. So the 1161, that is the Public Health Services Fund. That is the money that the governor, the Health First Indiana, that they gave us. Last year it was over 300 and some thousand. This year it went to 101. So they cut us. But we were able to use some of the cash that was sitting there. The state allowed us to, as well as the county. So since we only got 101,000, we were able to use some of that to subsidize that budget for this year. So that covered insurance, which is a huge undertaking, and a lot in salaries as well. And then we can always go back and ask that money that we have sitting there. We can go back and ask for that money. So I feel like if we run out of funds for particular programs, that we can go back in and ask for that money through them. Now, yeah, we still have to go through the county as well, but the state's been they've worked with us very well on what we needed, because they do know the cuts are extreme, so.
Well, I got a question.
Sure.
Regarding, the salaries or pay for the staff that are here. Is that comparable to other counties?
Well, they did a salary study. And so they raised up the salaries to like a minimum or a medium rate for all the salaries. And yes, the county
That's
moved those up.
comparable? Okay. Thank you.
Okay, and then the 8111, that is the emergency preparedness grant. That is the grant last year. They cut the 5,000 out, and the county allowed us to put that on. And it's actually Lori's salary. So this year we haven't heard, we did sign up for the next year, and that budget is from June or July 1st to June 30th the next year. So it's kind of a funky. So we're not sure what we might have to subsidize somewhere else for salary there. But I will say the county has worked very well on everything that we needed in this. The school liaison grant, that is no more, so we will not be doing anything with that. Any questions?
I move that we accept this annual report as presented.
Second.
All in favor?
Aye.
Any opposed? Who's doing Thrive?
Thrive is
Okay.
not here tonight. He did call, he has a conflict. They just wanted to give you information on the transportation that we had from last year. And so you should have that in your packet. The first quarter, they did 433 trips, and then they broke it down on how many trips in Clinton, Cayuga. Last year, we were able to give them 40,000. In 26, we weren't able to give them anything. So they're only doing one trip a week here to city or wherever in Vermillion County. So he just wanted to let you guys know, like the first quarter, they did 433 trips, broke it all down for you, and then broke it down for adults, seniors, 60. And then the next month, they did 506 the next quarter. And they broke that all down for you as well. And I think it's so important because we do have such the need for transportation in Vermillion County.
Yeah.
But I like it how they broke it down by ages. 12 adults, 34 seniors, 60 and over. And then what it went for, like doctor's visit. I know that's a lot of it is the physicians, doctor's appointments. And we seen them quite a bit last year. And the last quarter was 487 trips. I think that speaks volumes for Thrive in their program.
How are they funded?
I believe a lot of theirs is through grants. Mhm. So I don't know if he will come back to a meeting to talk to you guys about this, but he did ask me to make sure you have it, and if you guys have any questions that I could give it, I will email him them and he can answer them to you directly. I mean, I think they do a fabulous job for it.
interested in those denials. Say 123 denials.
You want me, I can send them
I'm
an
just
email.
curious.
Okay.
Yeah, I mean.
Yep.
Guess people have to change it. Oh, yeah. Yeah.
Right.
There's a lot of page something about there's no Tuesday, Thursday service. That's what those denials are. The denials are driven largely by no Tuesday, Thursday service.
And I heard Valley Professional was gonna help them cover some of this. Had you heard that?
I had heard, I know they also went to the city, they've also been to the county funding as well. I know the city wasn't able to help them, but I don't know what the county did.
But I think Valley Professional said that they.
Mhm. Yeah. Okay. All right.
Delinquent fees for retail food establishments.
So really what I am looking for, our ordinance, so a permit runs from January 1 to December 31st. We send out letters the first week of December, reminding people that you have to get your application updated, send in your fees, and then we'll send you a permit. There is no indication in the ordinance beyond January 1. Your term starts January 1 and you'll be permitted before you can operate after that date. We have no problem giving some grace period. Obviously, there's holidays in there, and if something's date marked the 31st, it may not get here till the 7th or, something around there. Joyce and I usually collaborate sometime mid-January and go through, and if we have people that we have not heard from, we'll send out another letter. Just a reminder, you are now late for your fees. The ordinance allows for us to have a late fee. There's a $25 late fee in the fee schedule, which we have never assessed because there's no time frame associated with that. At what point do we assess that fee? At what point do we say you cannot operate anymore because you have no permit? So that's what I'm looking for the board to kind of make some of those decisions. I know in Park County, if people don't have their money in by January 1, they start sending out late fees or they start visiting and closing places. Vigo County does the same thing. I don't know what the date is on those, but I know mid-January they started posting on doors in Vigo County. This place does not have a permit. They're closed until they were able to go pay their permit fee. So just looking for some guidance from the board on what kind of dates do we want to put in place so that we can be consistent going forward, assessing a fee.
What kind of fees are we talking about for the permit?
Currently, for the permit is a $50 fee right now
For the whole year.
for the entire
That's
year.
all we gotta pay is $50.
$50. The late fee, as is stated in the current fee schedule, is $25.
Just one time or?
It does not
Or like a
indicate.
month or?
So are you looking for guidance of how many days? I mean, like if you're 30 days late?
Yes, I'm looking for guidance so that we can have a policy of, we will begin assessing late fees on this date.
I'd like to hear from
And
Dr.
or,
Wheat's opinion on this.
and or we will
topic
shut you down on this date.
It needs clearly defined, and it never has been. It's
Right.
one of the other areas that we run into.
So what are your thoughts?
My thoughts are that I haven't given it any thought, to be frank. The first month, I would contact them by registered mail and level a $25 fee. If it carries on past the first month, I would probably consider it weekly at that point. If there's no resolution within 6 weeks, I would probably. That's what I would personally do without a whole lot of thought or any legal counsel on it. Or something very similar to that, but I don't think it's unreasonable to ask someone to pay a $50 fee for permit.
Oh.
I mean, that's almost laughable, frankly.
We are far lower than
Yes.
most counties.
I think that the other thing that we might consider is, considering potential for, some folks don't operate the same people that throw their mail away, they get their utilities shut off because they didn't know that they'd never paid in a year. It might even be worth reaching out to these people and making contact. I'm not suggesting, I don't know who would do that, but we could find somebody to reach out and say, hey, you're abysmally delinquent in this, and this is what's going to happen unless we resolve it. And then at that point, it might be, you know, a little more obvious what the problem is. I think it could be a lack of communication, but none of this has ever been outlined. You know, there's no system in place to deal with this. So I think that that's what we feel like we want everybody's opinion on it and proceduralize it so we can then operationalize it.
Right.
What about increasing the late fee? Because sometimes if you do that, then they're gonna get their payment.
You can, but if we do that, it's going to be as much as the actual permit.
Yeah.
So it
low.
starts to, I see what you're saying, Joni, absolutely, and I wouldn't be opposed to that. You know, to go to $35.
I was thinking 100.
Well, that's going to be twice the,
Well, if you don't get it in, you pay twice.
What
Yeah,
are the
that's-
other counties, what are their
Sure.
fees for the actual permit for the year?
Some are $450.
Oh,
I
yeah,
mean,
bingo
Literally
is-
higher.
yeah,
Gotcha.
it's-
Okay.
It starts to be real money, and it's also scaled in other places too, whereas it's not necessarily
Is
here.
it the same people every year?
some are.
And we wouldn't give a little price somebody clear out of business.
Clear out,
We got the
right.
small.
No, honestly,
So
the
many
ones that we
small
mostly
business
have trouble
anyway.
with are corporate entities where they've sent it off to a corporate entity to get paid and those corporate entities don't move very quickly. So it can take weeks and weeks and sometimes months to get something back. from
So
the
the
corporate
$50
office.
payment is due January 1st.
Yes, and we send letters the first week of December saying this will be due January 1. You need to have it in by then.
Would it be helpful to prepare a proposal for the board and then maybe work around modifying a proposal? Have a framework in place possibly, and then we can revisit it. Maybe that's something.
Gather some data from surrounding counties maybe and see what they do.
Good idea.
Yeah, I can do that. Yeah, thank you.
Thanks.
I think Joyce did say you did 2 mailings this year, right? So they got a reminder mailing.
And for those who haven't got their permit fee in, we send out just a reminder and they start coming in, but we've still got
We've
got
got,
a few.
currently we have 7
Believe
that have not, 7 that are delinquent. One of those is a seasonal operation that is not operating without a permit because they're not open yet. So I give them a little bit of grace for that, so.
Yeah.
Do we have a geographic breakdown? Or just off the top of your head, where are these places? Where?
I have a list.
I'm just curious how many of those are actually Clinton proper, spread out across.
2, 3 in Clinton, 4, 5. There's 5 in Clinton.
Okay. Talk about that. That may be something that we can communicate with city government. Too. It's pretty poor showing for one town. But I understand that most business is based. But that's another thought.
Table that for now. And that. Any new business? No public comment? Anything? Deb, you're still here.
I'm still here. We're still looking.
We're glad you're still here.
Yeah, when you have applicants, which I know you've had some, do they not want it because of the salary, the hours, or what are their reasons for not wanting it once they're? Did they give a reason?
The first one took another job.
Oh,
She decided to take a more full-time job. Our second lady, who was really sweet, was was gonna have a commute, frankly, and she, I don't, um, I was worried about that a little bit for her, frankly, and I think that she just decided that maybe she found a better option with regard to distance. We've got another interview, Thursday evening. Sounds like a really strong candidate, so we're hopeful. But I don't want to say it's a niche position, but it almost is. You know, you guys certainly know that there's such a demand for nurses. So nurses already have whatever it is they want most of
That's
the
what I
time.
wondered.
And, and so we're just kind of waiting on the right person to come along that maybe has another part-time job, for example, that wants a little variety or what have you. And so we're hopeful with this next applicant. Sure.
So Thursday evening, we will meet with them.
And I'm actively calling people too that I know that are nurses. Like,
too.
yeah.
That's
And
Yeah, I know Deb's reached out to several
Yeah.
as well.
Me too, Deb.
If not, then guess what?
Yeah.
Deb stays.
Well, we've got those mattresses. I could put Mike on the mattress. I can. Take care of him
We'll
here.
deal with, yeah, we'll all help you take care of it.
Oh, boy. I'll get that bell. He'll never get well.
Motion be adjourned.
Second.
All in favor? Aye.
You guys are doing a great job, all of you, I'll tell you.
What's that? Oh,
You're
yes.
doing a great job.
Is that nursing position a part-time position?
With flexible hours. And, you know, I've got